Good morning.
Good morning.
Oh no, good morning. 900 people strong, I want to feel this place rock. My name is Jacob Moody, and I'm president of the board of directors, and it is a really wonderful privilege to welcome you all here to King County. And home of my grandchildren, so that's what I'm saying. And I'm honored to officially open the 2022 HCH National Conference and Policy Symposium here at this lovely venue. Are you excited to see your colleagues again? I felt like I've been the moderator of Hollywood Squares with everybody in just little windows. And you all look so much better in person, so it's wonderful to be here. We want to start today with a land acknowledgement, and I want to introduce Art Rios Sr. Art is a board member on the board of directors and is chair of the National Consumer Advisory Board. So, Art.
Good morning.
Good morning.
As Jacob said, my name is Art Rios Sr. I'm the current chair of NCAB, and this will be a land and labor acknowledgement. The stolen land we live on in the Portland metro area are the traditional homelands of the Chinook, Kalis, Klamath, Molalla, Multnomah, and Wasco. While we visit in Washington State, we recognize the Shaleas, Lumi, Mokoshu, Kerala, and 25 other indigenous areas that give this acknowledgement. A land acknowledgement is important beyond the statement itself. It is about acknowledging the original and continued protected and caretaking of this land, many of whom were and continue to be prosecuted as they protect the land, water for all of us. It allows us to sit in gratitude for their energy and commitment to caring for the space, and reflects our understanding that we are part of an interconnection web, meaning we are now always responsible for caring for this space for generations to come. In addition to this acknowledgement, the land and those that have been here since time began, we must also remember our stolen siblings from Africa, whose labor built this vast wealth of this country. These two communities and the atrocities committed against them are intertwined due to our existence within the white supremacist world. Everything we have is due to stolen land, stolen labor, and every system and institute that impacts our lives is built upon this legacy. It is our job to speak that truth in space so that we can begin to heal. However, this acknowledgement is not the end of this conversation. It is not enough to ourselves into thinking that because we remember, we have done enough. BIPOC people continue to actively resist the institution and systems that have set the landscape for our continued targeting. We encourage our white community members to learn more about ways we can actively end this exploitation of Black and Indigenous people. And I'd just like to take one moment of silence. Thank you.
All of you know how difficult this last couple of years have been. That we're able to gather now is really a blessing. And we've also been blessed with some really extraordinary leadership at the council level, from staff, and particularly from this next gentleman that I will introduce, our CEO, Bobby Lyth.
Thank you very much, and thank you, Jacob, and thank you, Art. And just want to really just thank all of you. The work that the council does is to take the expertise that's in this room, with those with the lived expertise of homelessness, those who are on the front lines providing services, to just be the vessel where we can learn from each other, and then take those messages out to the larger healthcare system and to the larger society. So it's a real honor and privilege, and I've been looking forward to this moment where we can all be together for 3 years. It was last time, 2019, that we were able to meet, so we're just thrilled that we can able to meet together. Here in King County, we just really have to thank our partners. The King County Department of Public Health really took the lead when COVID first hit, and for the first time, our country was in new ways looking at what can we do to protect the health of people experiencing homelessness. King County was one of the first out the gate with guidances, with recommendations, how do we work with encampments, how can we provide street outreach, and we just really want to thank our partners. They have helped us. Yeah. I'm just going to say first names, but just really want to especially thank Simone, Reka, and Keith, who have worked with us. They provided, they gave us guidance on safety. They provided rapid tests for anyone who needs to test while they're here. They made those available to us here. And they also arranged site visits. So just really grateful for their leadership throughout this pandemic, throughout your work over the decades, and also for partnering with us here. Also here in King County is a friend and colleague that it's hard for me not to associate with them with Brooklyn. I knew Mark Dones for many years in New York City, where we both worked and lived, and was really surprised and grateful when I saw that they took a new position here as the CEO of the King County Regional Homelessness Authority. And since we're in their backyard, I want to give a couple minutes to Mark Dones to give us greetings.
Good morning.
Good morning.
Good morning. Thank you. It is a privilege to be here, and thank you for having me, Bobby. Welcome, if you are not from our neck of the woods, welcome to the Puget Sound. I am originally a Midwesterner, but I spent about 20 years on the East Coast, and now I am out here. This country has become a weird sort of home for me, despite, as we just heard, not being particularly welcoming to queer, non-binary Black people, but we're happy to do what we can for it. The Regional Homelessness Authority was formed by legislation in 2019, and then sort of as a result of the pandemic was wireframed, put on a shelf, and the good folks of the county went to work keeping people alive. I was appointed to this role in 2021, and as I was just telling Bobby in the hallway, I think there's a misconception about what I inherited, which is nothing. It was like running a startup out of a garage. I spent my first day trying to figure out how to get email. So if you are from here, I would ask for your patience, and if you're not from here, again, welcome. The thing about the authority that makes me proud and what makes me happy to welcome you here in this spirit is that the authority, I believe, is the first regional homelessness organization designed with the theory that if we listen to people who have lived expertise, we actually can end homelessness. That is our operating principle. One of my board chairs lives in a shelter currently. I experienced housing instability and poverty as a kid. I also have lived experience with the mental health system and was involuntarily hospitalized twice. Things that before I took this job, I was actually ashamed to talk about. And it is this position that has given me the latitude to say that there are things that I know, that those of us who've been to those places know, and can execute on, more importantly, right? Because incorporating what we know is not just an ethical thing, it's not just a moral good. We actually can end homelessness, we can center people, we can build systems of dignity and healing if you give us the shot of doing it. And so I'm proud to welcome you to a region that has embraced that and is on the journey to making that a reality. And I'm proud to be here at the Healthcare for Homeless Conference and to welcome you today and to be with people who I deeply respect, who know and live out those values every day. So I hope you take advantage of this conference. I hope you take advantage of the expertise that is here, lived and otherwise. There is a little bit of everything on the agenda, and a lot of good learning to take back to your communities. And if you're ever in the Puget Sound again, look us up. We're happy to host you. Thank you.
Thank you, Mark. I know Mark as a fierce and articulate advocate and passionate, and I am thrilled that they will bring that same expertise, passion, knowledge to government, where there theoretically should be more resources and more capability to execute the vision. Just want to say a few things, a few announcements. One of them is that want to make sure you familiarize yourself with the agenda for today. We understand some people have had trouble downloading the app. If you go to the App Store and type in NHCHC, it may pop up right away, but the full name of this event is NHCHC Conference and Symposium 2022. So please familiarize yourself with that. Also, as you know, we had to cut off registration. We had such high demand that we were concerned we wouldn't have enough capacity in the breakout room. So about 2 weeks ago, we cut off registration. So you are the ones who registered early and made it in. But because we have so many people, there's two things I want to say. One of them is when you select your workshops, also have a second one ready. Because if one of them is full, you may need to go to the other one. So have that ready. So please think of having two choices. Also, want to make sure that we practice good safety measures. We consulted with the King County Department of Public Health, with CDC. Our goal is to make sure that everyone stays safe. So thank you for those who uploaded your information to show that you're vaccinated or had a negative test, or for those that took a negative test here. We are going above what the minimum standards are because we know the conditions where you work. We know you work in clinics with people in poor health. You know, and personally, many of you may be going back home to elderly relatives or young children that can't be vaccinated. So we're asking everyone to wear your mask, except when you can socially distance like up here. Please wear your mask when indoors, except when you're eating or drinking. It's not just for you, it is for everyone. Also, want to just urge you to make sure you take good care of yourself. Take breaks. Use the Relaxation Lounge on the Cedar Ballroom on the second floor. And use our social media hashtags. They're in the app, in the program. And I just want to say, well, one of the reasons I'm so thrilled is really love the theme for this year's conference, toward health and belonging. Toward means we understand that we are not there yet, but we're moving in the right direction, or we want to be. We're talking about health. Health is the optimum state of well-being. Physical, mental, spiritual, social well-being for society and for individuals, how we fit in society, and belonging. Several years ago, our theme was inclusion. And the motto was, everybody in, nobody out. And we aren't there as a society yet, but we want to be moving towards true belonging, where everyone is not just there, but they know that they belong, that they are welcomed, they are accepted for who they are with their rich complexity. And unfortunately, we know in our society, especially for those in the population that we serve, people experiencing homelessness, many of them are purposely made to feel that they don't belong because they're poor, which is what we do to poor people in this country. We have criminalized poverty. We have criminalized medical conditions, especially mental illness and substance use disorder. But we have an opportunity here. We want to talk about that, how we can move towards health and belonging. And this is part of our policy symposium. This part is not done with, not produced with our federal partners. So really want to thank our members, our organizational members, and our generous sponsors for this event that make this part and other parts of our program and our work throughout the year possible. Want to thank our platinum sponsors, California Healthcare Foundation and United Healthcare. Want to thank our silver sponsors, Gilbar Consulting and Humana Healthy Horizons, and our bronze sponsor, AbbVie. So now I'm going to turn it over to Cassandra Frederic. You want to say a few? Among other victories, Frederic was the architect of the campaign that cut the number of New York City marijuana arrests by more than 99% since 2010. I'll just say, Frederic has received many honors. She is a graduate of Cornell University and also of Columbia University with a master's in social work. Frederic, please tell us how we can move closer towards health and belonging. Thank you.
Well, first of all, thank you for having me. Again, my name is Cassandra Frederic. I am the Executive Director at Drug Policy Alliance. We are a national organization that works to end the war on drugs. Does that mean I am for the legalization of drugs? Yes, actually. I am for the legalization of drugs. You are also getting, this is my first in-person talk. In 3 years, I'm a little nervous, definitely rusty. That's why I asked for 40 minutes back on the clock. All right, y'all, let's see how it goes. So why am I here? You know, people in this country are fed up. They're fed up with our inadequate solutions to homelessness, to addiction, to mental health. Right? People are upset. We're seeing it in the news, right? Yet people are stumped as to what to do next. While some people are pushing for law enforcement, there's a growing group of people who are building a bridge to a different world. One that doesn't include stigma, criminalization, and coercion. I'm here because I am very concerned that those people who are building our new world will again neglect to center our loved ones. We can't afford to build a new world that doesn't adequately support the needs of our people. And that is why my title of this talk is Building Our Table. Unapologetically centering our community's needs so that all people can thrive. The war on drugs and its health impacts. My colleagues talked to me about this and they were like, you're going to healthcare for the homeless? They kind of know this stuff. So I'm gonna go really fast on this, right? So drug offenses are the leading cause of arrest in the United States. So it means if someone is engaging with law enforcement, the number one reason why they're more likely to be engaged in that is because of drugs. Because they suspect someone is under the influence, they suspect someone has possession, or someone is selling and trading. The number of arrests in 2020 in the US for drug violations was 1.5 million people. Okay? And the vast majority of those arrests were for possession. are 24% of those arrested, despite making up 13% of the US population. And we know why. It's not because Black people are more likely to use drugs. It's because Black people are more likely to be targeted, surveilled, and criminalized, right? They're in our neighborhoods, they're in our homes, they're in our clinics, they're in our safe spaces. And it is not a coincidence as to why certain people are criminalized more than others. Especially when we talk about drugs, race and xenophobia has been embedded in the drug war from the start. The war on drugs targets low-income people, racial ethnic minorities, and it puts the thing about drugs, which it sounds very similar to the things that y'all deal with, is that they put the onus of the problem on the individual to change, rather than change the policies that created the conditions for people to be in these terrible situations. Bobby told me I can't curse, so it's going to be really hard. The approach has been disastrous, right? The health impacts of incarceration are deleterious. We see that overdose has shot up 600% in jails and prisons. 600%. People put people in jail and prison because they want them to stop doing the behavior, right? So we're supposed to be safe in jails and prisons from drugs, right? From violence, from sexual assaults. Yet how many people in this room actually believe jails and prisons are a safe place for people to be? Raise your hand. How many people in this room know that jails and prisons is one of the most dangerous places you could be to deal with complicated human behavior? Y'all better raise your hands in here. And it's on purpose. This is the thing that I refuse to apologize about. This is the reason why I think we need to unapologetically center our needs. Because these people knew what they were doing. These policies that have encapsulated our communities, Black, Indigenous, Latino, queer, are on purpose. They made these policies because we are not supposed to be in the public. Because we are not supposed to be seen. Because they want to protect their property value. This country is created on stolen land and stolen property and stolen labor. And that is what they are protecting. Our policies are not to protect people. They are to protect capital. They're to protect property. And they will do anything to disappear our community members. They do everything to disappear my loved ones, your loved ones. So when we talk about the war on drugs, the reason why I'm standing here today, why this is my first conference in person, why I'm not in my family room, this is y'all family room. I'm gonna ask to be a part of your family, but I'm not with my people right now. The reason I came here first is because we are under attack. When we look at the overdose crisis, Black people are dying at the highest rates. This is different, right? Because since the overdose crisis started 20 years ago, we have lost 1 million people. And estimates suggest we will lose over 100,000 people alone in 2021. And 2022 does not look much better. And in fact, it is on track to be higher. And one of the reasons that I'm also here is because I know that not all people who are unhoused struggle with drug use. I'm very, very clear about that. And I also know there are people who are unhoused who are also struggling with addiction. That those two things can be true statements. And it is important that the stigma that our communities have on each other do not conflate and do the work of our enemies. We're working for them when we hold the stigma against our communities. I know that people who struggle with substance use, most of those people are housed. But I'm here because of the people who are not. The people that are navigating addiction, the people that are dying in our homeless shelters, the people that are dying on the street, because every overdose death is preventable.
That's right. That's right.
It is preventable. And the thing that is so interesting about this moment, for me, is that I recognize that Bobby could come up here and give this speech at the Drug Policy Alliance conference and would be saying the very similar things. Nothing, you could literally switch out drug policy and addiction and overdose with the stats of people that are unhoused. When we think about the stigma, when we think about the lack of access to resources, when we think about the criminalization, when we think about the surveillance, and when we think about the stigma. Am I lying?
Tell the truth. Speak the truth.
Listen, I'm from New York. It is very early. And if I'm gonna stand up here, you're gonna talk over here. So do you hear me? Yes. This side of the room sounds very quiet. Do you hear me?
Yes.
Thank you. For the first time ever, the overdose rate, as I said, is highest among people of color, specifically Black people. And this point I want to say here that you see is that because the overdose crisis is going up amongst Black people, the concern around overdose among white Americans has gone down. Y'all see that? And part of it is because when we started with the overdose crisis, the conversation focused on how doctors were literally over-prescribing. Y'all remember that? And that people were accidentally falling into addiction. The research showed that that was not the case. Now, I'm not saying that Purdue's and the Sacklers were not capitalists and flooded our communities. What I am saying is that the people that struggled with addiction, those prescriptions were not theirs. But what do we gain from the rhetoric? We gain the protection of the idea that some people are supposed to be addicted and some are not. There are similar thoughts and narratives between our communities that consistently make it difficult for us to meet each other in the middle and for us to move forward. And criminalization continues to be the thing that they push on us and on you. Understanding that we have to get rid of these encampments. We have to get rid of these people using drugs in the street. We have to get them inside, and if they don't want to, what is the thing at stake? Our autonomy. They want to tell us what to do. That's why they put us in jails and prisons, because they can control us there. And the thing that is at the crux of the work that we're doing is people's right to exist, their dignity, and their ability to do what they want and to make choices for themselves, and for people who are service providers to respect them and build a plan that works for them, not for our own comfort levels. Just so y'all know, I usually don't speak with notes, but because I'm in charge of DPA now, they really want to make sure they know what I'm saying. So some of these slides don't match, okay? Y'all know this stuff already. You know, homelessness and overdose deaths are skyrocketing. It's one of the leading causes of deaths of people that are unhoused. This is a stats from LA County. Continue. continue. This is how you know someone has gave me these slides, right? They're like, focus on overdose, Cassandra. Don't talk about taking down capitalism. I'll find it where I'm at right now. Sorry, Barbara. You know, one of the things that I said earlier, right, was the idea that the reason why we're in this situation, oftentimes people put the onus on individuals. But the thing that we have learned, and the thing that y'all know already, is that they have created these conditions. They have literally created the policies that make it difficult for people to live and to thrive and to make choices that work for them. And for a long time, the organization I work at, we focus solely on drugs. We just wanted to deal with ending drug prohibition. We only thought that that was our only lane. And as Bobby said, I'm a social worker. I do believe in the abolition of social work because I think it's a problem. But I'm currently a social worker. You know, I have the student debt for social work. And the thing that I have realized and I sit with is that the drug war is in every system that people engage with. That it's not just the criminal legal system that puts drug laws on people, right? That it's every single system that people engage with have been perverted with the drug war logic. So it's not just judges and prosecutors and police officers that are enforcing drug laws. It's social workers in the child welfare system. It's teachers in the education system. It's caseworkers in the public benefits office, right? It is the housing counselors that are going out of their way to not give people the resources and services that they need. And I think it's important for us to be really clear about who is enforcing these laws. Because a lot of people no one sees them. There is this invisible web of actors that are going out there every day making it harder for your clients. They are putting up arbitrary laws that make it difficult for people to get the resources that you have searched for. There are people who are kicking people out of programs, kicking people out of shelters, based on rules that don't make sense for the conditions people are living under. And then we wonder why people are unhealthy. We are in a state of gaslighting. It is structural, it is systematic, it is insidious. And even every good person here, even if you know everything that I'm saying, we all still hold that bias. It is something that we actively have to work against in order to show up as a full human being for the human being that is sitting in front of us. That is the work they don't pay us for. That is the work they don't train us for. That is the work they don't develop us for. And so when we talk about uprooting the drug war from these different systems, it's not just from the systems, it's from our spirits as well. It is understanding that we are at this moment because we're all a part of a system, intentionally and unintentionally, subconsciously and complicitly. Evictions and homelessness are associated with increased related drug health harms, including overdose and syringe sharing. And I know a lot of people here, Jack told me, that his organization started as an HIV/AIDS organization first. Like that was part of the conversation. So we know what it means when people are sharing equipment. We know what it means when people have to deal and use chaotically in the street because they don't have places to go. And our policies make that so. And then we blame people for the conditions that they live under, the conditions that we have created. The Coalition on Homelessness in San Francisco surveyed unhoused people who use drugs and found that nearly everyone said they could not address their drug use without housing first. This is my dear friend, Emily Ramos. She talks about her father and his struggle with drug use, and the fact that his drug use precluded him from keeping his public housing, and how that caused him to be unhoused, and how that actually made his drug use more chaotic. We know at Drug Policy Alliance that housing insecurity is deadly. We know that eviction increases the risk of overdose deaths and homelessness, and that tens of thousands of people have lost their homes based on their drug use, based on these misguided policies. I'm here because the drug war creates your clients. And I need to work with you. And you need to work with me, because we won't end homelessness if our policies continue to make unhoused people. In the 3 years of the pandemic in 2020, these are the headlines that were hitting all over the newspaper. Homeless evicted from Minneapolis hotel after drug overdose. Surviving an overdose can get Midwesterners evicted. Granite City renters face eviction over drug overdose 911 calls during opioid epidemic. West Virginia cites evictions to combat opioid epidemic. Forced out of a home over a marijuana joint. What the hell are we doing? Hell is not a curse, Doctor. What are we doing? I don't know about you, but I had dreams of doing something else than ending the drug war. I want to be chilling with Rihanna on a yacht. I don't know if you have those dreams, but if you could do something else, what would you do? How would you spend your time? We're in this room because we care. Because we can't let wrongs go unrighted. Because we believe in the dignity and autonomy of people. And we believe in the power of change. And we should all be trying to work ourselves out of the job. But we can't do that right now. And we can't do it because of the moment that we're in and the policies that continue to dictate our well-being. You know, I heard the theme, right, toward health and belonging. As a Black woman from the United States, I don't want to belong to this shit. I actually don't. And I don't think you want to either. You know, we're in this moment where there is a conflation between public disorder, right? The presence of unhoused people, the presence of open-air drug markets, the presence of drug use, the presence of people having severe mental health crises, and violent crime. How many people are watching the news and hearing how this country is going down the toilet, right? That our cities aren't the cities they used to be. Everything is terrible. We're falling out of control. Who are they talking about? What is making people think the city is going down the tubes? What are people actually talking about? People are upset because they see visible poverty.
There you go. There you go. Right.
Because they see people and they're scared. Yeah, those are the people that have the most power. Isn't it hilarious when the people with the most power are the scared ones? And when the most powerful are scared, they are the most dangerous. That is when our rights become eroded.
True that.
And I want to be clear. Folks are consistently talking about the public. But we are the public too. People who are unhoused are part of the public.
Hey.
Are they not?
Yes. Yes.
People who use drugs are part of the public. People who are navigating severe mental health crises are the public. And so what I'm saying to you is that I don't want to belong to a public that doesn't think that I am a part of it. And as a Black woman, I want to be clear. I will not crawl to freedom. I will not. And neither should you. And neither should your clients. Our systems have made people expendable. And they have used fear as a reason to make those people expendable. To make the question less about how do we make these people healthy, whole, and housed, and more about how do we disappear these people? How do we make sure that I'm not scared walking to the train station? How do we make sure that the streets are clean? How do you make sure that I'm clean? How do you make sure that I have access to a public bathroom? How do you make sure that I have clothes that I need, that I can be warm, that I can stay dry when it rains? Why aren't those the questions? Why are we focusing so much and letting fear drive our policies, letting it be used as a reason to erode our autonomy, our dignity, our resources? When I got to the Pacific Northwest, I was in a lift. I literally was in the lift for 2 minutes. The woman says to me, you know, Portland is a great city. It's being tarnished by homelessness. And I was like, oh, it's not being tarnished by unaffordable housing? It's not being tarnished by the overbloated budgets that you're giving to law enforcement to go and like talk to people and take people's belongings and throw them out? Man, people are just so weird. The underlying logic of this conversation undergirds the drug war as it undergirds unhoused people, right? It's this idea, this twisted logic that prioritizes property and capital over the rights and dignities of people, right? People who use drugs and are unhoused are untrustworthy. People who use drugs and unhoused can't be good tenants, parents, or community members. That we are a burden, that we need to be forced to comply, that we don't make good choices, can't manage our money, are wasteful, and we are dangerous and threatening. What all these logics have in common is using stigma and marginalization to blame individuals for systematic problems. Failure of our policies and systems being used as an excuse to double down on criminalization. People talk about COVID as if it opened their eyes to a new situation. But what I heard Bobby say is that y'all were here in 2019, which means y'all were also here in 2018, 17, 16, right? So this issue that y'all have been dealing with is not COVID related. COVID may have exacerbated the conditions that we work under, right? But if everyone was housed before COVID, we wouldn't be here, right? If we had dealt with the issues that we had, a worldwide health pandemic would not have busted this thing wide open in the ways that it did. It wouldn't have created more unhoused people. It wouldn't have pushed more people to struggle with addiction. What COVID did was supercharge what we were already dealing with. Yeah. We were already drowning. We were already struggling. And COVID just increased the pressure. But it also opened the door for new solutions. The thing about COVID is, all of a sudden, everyone was like, maybe we should give people rooms. Was that not weird for you? For me, I was just like, you think? You know, for us, it was like, maybe we should give people take-home methadone. I was like, you don't say. Maybe we should actually respect healthcare workers. Amazing! This moment is not about resources. We have them. It is about political will. And it is about ending stigma, right? And stigma is legalized discrimination. It's about moving the funding from law enforcement to be shifted to people that are providing resources, right? And I think the thing for me is that I want to know from you, what will it take for us to defend the dignity of our communities in the middle of this pushback, where people are asking us to apologize for our existence? How can we avoid throwing people under the bus? We need a radical, inclusive love that does not leave anyone behind. My friend used to work at Victoria's Secret. And she told me that whenever they were ready to storyboard, they would think of a particular person. This was a person in the design room that they all thought about. Her name was Jessica. She was a young white woman in the Midwest. And so when you think about Victoria's Secret and the stories and the fashion show and the kinds of bras and underwear and robes and perfume, they thought about Jessica. Will Jessica buy this thing? And that has always been super moving for me as someone who is an organizer and someone that does legislative advocacy. Because if we want to build a new world, who are we building it for? And this goes back to the belonging. What is the world we want to build? What are the values? If we are building a better world, we need to start with our folks, rather than retrofitting our folks in after the fact. What does a Black, disabled, trans, queer, unhoused, sex working, and drug using person need to thrive? That is the question that is centering the work that we do at the Drug Policy Alliance, and I offer to you. If we want to build a new world, we have to disabuse ourselves of the idea that we can belong in this one. Because this world was never built for us. There's so many people in this room that this world never took into account. I encourage you to look at this report from one of our allies called SNAPCO, Solutions Not Punishment Collaborative, which is a Black LGBTQ community organization fighting for everyone Black in Atlanta. And everyone else. But they say we're fighting for everyone Black. Kind of like Lisa Ray, which was like rooting for everyone Black. I don't know if you know the reference, but you can do it. They wrote a report called Deeper Than Visibility, understanding that they needed to build a legislative advocacy movement building infrastructure that focused on dignity, autonomy, power, healthcare, homes, money, fulfillment, and abundance. These words mean more to me as someone leading an organization because I recognize that I need to stop apologizing for people for using drugs in the street. I need to stop apologizing for people who are selling drugs. I need to stop apologizing for people who are navigating really hard situations. Because there is a conversation and a space for personal accountability. But there's a bigger conversation as to why people are navigating the conditions that they are. And that's the conversation that we rarely have, and that we rarely stick to. And y'all know that because of the work that you do every single day. You know, I am a harm reductionist, and I think a lot of people in this room would also identify as harm reductionists. And part of the reason that we're here is as an invitation. We know that we can't do this work without you. And I want to implore for you is that you can't do this work without us either.
Right. Yeah.
We need to come together across silos and recognize that we are in the same fight. Because the things they say about you are the things they say about us. And recognize that harm reduction is a verb. And to us, that means when we talk about our harm reduction, that our issues around overdose prevention centers, syringe exchanges, low threshold medication maintenance, and supportive housing, all things that we know are evidence-based interventions, I'm asking you to work with us to include them in the healthcare that you provide in your institutions. Healthcare for people who use drugs is more than naloxone. It's giving people access to syringes. It's giving people access to safer smoking kits. It's understanding that some people need to use drugs to survive and navigate the conditions that they're doing now. And we can't be in a world where they're getting healthcare over here or getting housed over there and using drugs over here. Those things have to come together. It's hard, it's difficult, I understand. But our people are dying. And the whole point of me being here is because my people are your people. They are our people. They are my cousin. Decriminalizing drug possession, removing drugs from the criminal legal system, and will allow other avenues for people to get access to resources. and offering community-based alternatives. So one of our biggest questions to you is how do you infuse those things into the services that you're providing currently? When I looked on the Healthcare for Homeless website, I saw that it said harm reduction, and it said motivational interviewing, it said yoga, it said all these different things. But next year I wanted to say syringe exchange. Next year I wanted to say overdose prevention centers. Next year I wanted to say safe supply. I wanted to say housing first. Because my people are here. They're here. My cousin was unhoused. We found him in the park by himself, dead. I care. I know you care. We have to care together. We have to care together. We are pushing for innovation. We are pushing to build a new world that centers the people that need the most. Those people are not a burden. Those people are us. They are what we need. They're what we understand. There are conversations that are happening in our spaces that are happening in separate rooms. And the cost of that is lives. I know that the stigma associated with drug use makes your work more difficult. I understand that. But I also understand that that stigma is created so that we don't work together. And so that it makes it harder for the people that you work with. As healthcare providers, you can do a lot. Clinicians are powerful advocates. And I say clinicians, I don't mean doctors. I mean the people that are doing intake. I mean the people that are walking people to resources, to housing, that are filling out forms for people, that are doing street outreach. We are all the experts. And there's a lot of work that we can all be doing together. We are ready to do the work, to build the bridge, to create our own public, to invite people to belong to our community. I hope and pray that you are willing to do it too. Thank you.
When we looked as a staff and management team, because every year we brainstorm on who do we want for our keynote speakers, we quickly coalesced around Cassandra Frederique and the work of the Drug Policy Alliance. And we see, I hope you see why. As Cassandra said, we need to be working together to two movements. The failure to do that, the cost is lives. We know that our patients, our clients are dying because of the stigma, which the term she used is legalized discrimination, how that is hurting them and it's hurting us and it's hurting public health and how it's hurting society. So please look up the work of the Drug Policy Alliance. They also are a national organization. Find out how you can work together with them in your communities to protect our patients, to protect those who are unhoused, to protect those with substance use disorders. And just really moved and thankful for those words, and I hope that we will continue to take them to heart. Hearing, I don't know if you could see, but there was a tear running down the cheek of Cassandra as she was speaking, not for show, but because of the real cost in human lives, and that our need to redouble our efforts to work together. This work can be hard. Just talking about it can be hard, much less doing the work. So again, urge you to take self-care throughout the conference. Also want to make sure, again, I'll repeat about our Relaxation Lounge in the Cedar Ballroom on the second floor, on the second floor. So use that. Also, please continue to keep each other safe, physically, as well as emotionally. And so please, to keep ourselves safe physically, wear your mask when you're indoors, as much, except when eating or drinking. A note about food, we purposefully have food in containers so that you can take the food and come back in here if you feel safe doing that, or go to your room or go somewhere else. There's also additional seating on the second floor where you can take your food. We're going to break now for our tremendous learning sessions. They start at 11:45. Excuse me. Start at 9:45 in a few minutes. Go to 11 o'clock where we'll come together for lunch. So just really, this is the highlight of the year after year for me. When I was before I joined the staff of the council, we're in for a rare treat, and the treat is each other. So treasure each other, get to know each other, learn from each other, and then go forth back into our communities with the lessons that we learn and the energy that we learn. Please thank Cassandra Frederick again. And go forth to learn and serve. Thank you all.